Welcome. Have you ever experienced a strange tingling or numbness in your hands and feet? It could be a sign of something called polyneuropathy. Today, we're diving deep into this nervous system disorder to understand what it is, why it happens, and what can be done about it. So, what exactly causes polyneuropathy? Think of it as a disruption in the communication network of your nerves. Many things can trigger this disruption. Diabetes is a major culprit, where high blood sugar levels damage nerves over time. Other causes include autoimmune diseases like lupus or rheumatoid arthritis, infections such as Lyme disease or shingles, exposure to toxins like heavy metals or certain chemicals, inherited disorders, vitamin deficiencies particularly B12, and even some medications like chemotherapy drugs. Sometimes the cause remains a mystery, which we call idiopathic polyneuropathy. To understand polyneuropathy, imagine your nerves as electrical wires transmitting signals throughout your body. In polyneuropathy, the myelin sheath, which is the protective insulation around these wires, can be damaged. The nerve fibers themselves can also be injured. This damage disrupts the nerve's ability to transmit signals properly. Signals might be slowed down, sent irregularly, or not sent at all. This impaired communication leads to the various symptoms experienced in polyneuropathy. Polyneuropathy is more common than you might think. Because diabetes is a leading cause, its prevalence is closely tied to diabetes rates worldwide. It's estimated that millions of people are affected, and the risk increases with age. Factors like alcohol abuse, poor diet, and exposure to environmental toxins can also influence the number of people who develop this condition. The symptoms of polyneuropathy can be quite varied, depending on which nerves are affected. Commonly, people experience a gradual onset of numbness, tingling, or burning sensations, often starting in the feet or hands and progressing upwards. This is often described as a stocking glove distribution. Muscle weakness, especially in the feet and legs, can occur, leading to difficulty walking or balancing. Sharp, stabbing pain is also a common complaint. Some individuals might experience problems with coordination, loss of reflexes, and even sensitivity to touch, where even light pressure can cause intense pain. In severe cases, autonomic nerve damage can lead to problems with blood pressure, heart rate, digestion, and bladder control. Diagnosing polyneuropathy involves a thorough neurological examination. Your doctor will assess your reflexes, muscle strength, sensory perception, and coordination. Several tests may be performed. Nerve conduction studies are the speed and strength of electrical signals traveling through your nerves. Electromyography, or EMG, assesses the electrical activity of your muscles. Blood tests are crucial to identify underlying causes like diabetes, vitamin deficiencies, autoimmune diseases, or infections. In some cases, a nerve biopsy may be necessary to examine the nerve tissue under a microscope. Polyneuropathy isn't a single disease, but rather a category of nerve disorders. It's often classified based on the type of nerve affected: sensory, motor, or autonomic, or by the underlying cause, such as diabetic neuropathy, inflammatory neuropathy, or toxic neuropathy. Different classifications help guide treatment strategies. For example, CDP, or chronic inflammatory demyelinating polyneuropathy, is a specific type characterized by progressive weakness and impaired sensory function, often requiring immune-modulating therapies. Unfortunately, there's no cure for most types of polyneuropathy, but treatment focuses on managing symptoms and addressing the underlying cause. If diabetes is the culprit, strict blood sugar control is essential. Medications like pain relievers, antidepressants, and anti-seizure drugs can help alleviate pain and nerve discomfort. Physical therapy and occupational therapy can improve muscle strength, coordination, and daily function. For inflammatory neuropathies, treatments may include corticosteroids, intravenous immunoglobulin IVIG, or plasma exchange. Lifestyle modifications such as regular exercise, a healthy diet, and avoiding alcohol and smoking can also make a significant difference. While not all cases of polyneuropathy are preventable, there are steps you can take to reduce your risk. Managing diabetes effectively is crucial. Maintaining a healthy weight, eating a balanced diet rich in vitamins, and avoiding excessive alcohol consumption can also help. Be cautious about exposure to toxins, such as heavy metals and pesticides. If you have a family history of inherited neuropathies, genetic counseling may be beneficial. The prognosis for polyneuropathy varies widely depending on the underlying cause, the severity of nerve damage, and the individual's overall health. Some types, like those caused by treatable infections or vitamin deficiencies, may improve significantly with appropriate treatment. Others, such as diabetic neuropathy, may be more chronic and progressive. Recent research is focused on developing new therapies to promote nerve regeneration and reduce nerve damage. Advances in gene therapy and targeted drug delivery hold promise for the future treatment of polyneuropathy. Always consult with your doctor to discuss your specific situation and treatment options.